Good morning, everybody, for joining this webinar session on ADHICS compliance today. So I am Sheikh Shahnawaz. So I am the cyber threat management lead in Crowe UAE. So we'll jump in, right? We'll not waste much time, and then I'll just quickly jump into. So can we move to next slide? Yeah. So I'll not take time on about Crowe because it is covered by Manish. So I'll quickly jump into the agenda. So yes. Okay. So, so what exactly we are going to cover today for this next 1 hour? So to set the context, so this is the agenda that we are going to cover. So first thing, before getting into ADICS, I want to first touch upon what exactly are the digital transformations that are happening in GCC. Okay, then what are the cyber attack trends that are happening in GCC, and then okay, four core pillars. Okay, because ADICS compliance framework actually is based on some four pillars. So if we are actually complying or if we are adhering to these four pillars, mostly we will be getting compliant to all the different domains that are a part of ADICS. So I will touch upon these four core pillars and then we will get into the benefits of compliance with ADICS. So what exactly are the benefits or the advantages we get when we are complying to ADICS? And then what ADICS and why it matters, and also we'll get it from fifth agenda point. So we'll get into more details of ADICS, like what are those different domains, what are the key compliance domains from the total ADICS domains, and then how the IT team can actually help in achieving or this particular ADICS domain, and what are the different gaps with our experience that we have identified, because we have been doing ADICS compliance for multiple customers. So we know there are some common gaps. So we have just listed down some common gaps and have highlighted in this webinar, and some practical implementation roadmaps and documentation tips how the organizations should go about in adhering or complying to ADICS compliance. And then we will end like maybe in last maybe 10-15 minutes we'll have a Q&A session. So yes, can we move to next slide? Yeah. So yeah, you can, yes, you can enter. Okay, so see, as we all know, so I'm not getting into ADICS directly. I'm not jumping into the ADICS part directly uh, because to understand or the importance of ADICS, first we need to know the regional specific initiatives and the strategies the government or that the international level, the organizations or the country at an government level, the strategies that they are building. So if you see, so in GCC countries, so we have a lot of visions that are planned, right, for the next upcoming year. Like for Saudi Arabia, if you see, we have like huge, right, there are billions of dollars being spent in digitalizing, all right. So there are a lot of investment being made to transform into digital world. So similarly in Saudi Arabia, we have 2030 vision. In UAE, we have 2071, which is like next 5 decades of plan that is being by the right the UAE government have decided, and it is there on the internet also available, that what are the different areas they want to achieve in the next 5 decades. And similarly in Bahrain, we have this. So I'll not get into all the details. So but the 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 summary of this slide is, or the takeaway of this slide is, the organizations or the government is strategizing to move to digital world. And so can you click enter, Anumi? Next. Yeah. So if you see this, no, can you go back? Sorry. Yeah. So if you see this, the critical infrastructure protection is paramount. Obviously, when you are actually planning to move to the digital world. So these actually are the two important factors, like critical infrastructure protection. Obviously, the infrastructure that you are using to move to digital world, is the protection of that critical infrastructure has become most important or the utmost priority for the government and also for the organizations that are in this particular regions. And second, digital transformation introduces new cyber. Obviously, as we know, when we move to cloud, when we move to the internet, when we connect, obviously we end up with a lot of new cyber threats that will get evolved. So these two are very important, which we need to align with the strategies that government is aligning towards. Okay, next. Okay, so now cyber attack trends in healthcare sector in GCC. Okay, so if you see this, right, in 2024 first year, right, first 6 months of 2024, you can see 10 million plus compromised user accounts were discovered in dark web. So which is not a small number. So 10 million plus compromised user accounts. So these are all the patient user accounts, or can be right any medical or hospital user account, or any user account that are related to healthcare sector. So there were 10 million plus users that have been discovered on dark web. And then if you see in 2025, you can see it is 450 million users. So the patient record stolen is actually in very large scale. And now why exactly is this happening? Why so much of data is getting exposed? Why this data is being going to dark web? Obviously, the regional hospitals lack basic cybersecurity measures. So they don't have, right? So because healthcare sector is more into right strategizing how to better the medical facilities to the patients and all, but they don't. I think cybersecurity is somehow it is being lagged. So there is like right. All the regional hospitals have lacked basic cybersecurity measures. So can you next? Okay, so now medical data, right? Medical data sells 10 times more than financial records. So this might be surprising to some people, but people might say that, okay, financial data is more valuable than medical data. But for everybody's information, the people's safety and people's life is of utmost priority to everybody. Like be it in cybersecurity, be it in any sector, people's life and people's security comes on top priority. So now when I say medical data, so medical data is all related to people's life and people's safety and people's security. For example, if there is an treatment going on, right, maybe some heart surgery going on, maybe something happening, and then just imagine you are right, whatever you're using, the medical equipment, the heart monitoring system or something just is being attacked and it is not coming up or something. Just imagine, right, the doctors are now like clueless how exactly do or what to do. I'm saying they might do it, but you might understand the challenges that they might come across. So for this matter, medical data actually sells 10 times more on the dark net than compared to the financial data. So we have to be very careful with our medical data, with our patients data, with right all the related information with respect to healthcare sector, because it is being sold 10 times more than financial records on dark web. Okay, can you move to next slide? Yeah. So key insights of that slide is Saudi Arabia and UAE actually are the most significant affected. If you see in the GCC countries, so UAE and Saudi Arabia being the top affected data, because there are a lot of I don't want to name the hospitals or the insurance organizations, but there are a lot of organizations like healthcare sectors that have been affected with data breaches and ransomware attacks, which right led to a lot of data leak, like some millions of data has been leaked from those healthcare providers. So Saudi and UAE being on the top in the GCC region. So okay, so now so till now I was just talking about the background or maybe the setting up the foundation, but now I will jump into ADICS. So ADIC is Abu Dhabi Health Health Sector Information and Cyber Security Standard. Okay, so it stands for like Abu Dhabi Health Sector Information and Cyber Security Standard. So it is a standard for all the healthcare sectors that are operating in Abu Dhabi. So you can actually uh, compare this maybe in HIPAA in a USA, which is there like healthcare policy in USA. So similar to that in Abu Dhabi, which is right by DOH, Department of Health. So ADICS is a mandatory compliance requirement for any organization or for any healthcare organization that is operating in Abu Dhabi. So that is first part. And now what exactly are the four core pillars of ADICS? So if you see governance and risk management, incident response strategies, cybersecurity capability assessment, and then collaborations and integrations. So if in case I go in little detail about these four, if you see governance and risk management. So it's all about having a first place is having a governance, having a strategical discussion with the leadership team, with the management, with the leaders of the healthcare sector to first create or establish policies. How are we going to handle in case of any risk, right? In the cybersecurity for the healthcare sector. So what kind of governance do we have? What kind of policies we have? What kind of procedure documents do we have? So do we have the required set of policies available to handle the situation in case of any cybersecurity attack, in cybersecurity incident. So do we have those kind of governance or policies available in the market, in the organization? Second, the incident response and strategies, right? So when there is an attack, how should I go about it? What should I do? Right? Do I have a plan for that? What should I do? Like, should I reach out to my IT team? Should I reach out to my cybersecurity expert? To whom should I reach out to? So is there that particular whole right SOP document, you might call it, or maybe right the incident response, like how you want to respond to that particular incident? So do you have those action plans available for detecting it, or for responding it, or for that matter recovering it from it? For example, just detecting and then not responding to it and not containing it and not recovering from it will not make sense. So when you detected something, how will you respond to that particular detection? If you have responded to it, then how will you contain that particular thing? If you have contained it, then how will you get recovered from that particular cyber attack? So this is an entire life cycle of an incident response. So it's not only about detection, or it is not only about responding. So does the organization have this total incident response strategies? And then cybersecurity capabilities and assessment. So here we get into more of technical aspect. So I think top two, it is more of process oriented, people oriented, everything. But if you see the cybersecurity capability, is more of a technical measures. Like it maybe you might need an cybersecurity expert here, right? How exactly your technical measures you like, you call it defense in depth, right? Like how exactly, for example, if one of your perimeter is compromised, do you have any other perimeter that is available in your organization to protect you from that particular attack? So do you have those kind of protections available? So here you need some cyber security assessments to be done on the technical controls that you have in your organization, to find out whether those technical controls are capable enough to withstand any cybersecurity attack. So you need those kind of assessments to be periodically done in your healthcare organization, healthcare sector. And then last one is a collaboration and integration. So you have to have know what is happening right around the world, what is happening, right? So how exactly you can improve your healthcare sector data, data security, or right, what all different things that you can partnership, you can have some partnership with some government agencies, cyber security experts, to get and integrate your whole process, aligning to the best standards that are available in the market, so that you are not right, you don't become a legacy, or you don't become right like an old standard or something. So you always are right par with the latest advanced technologies or processes, or right what's happening, right? So you need to have that collaborations and integration. So these four pillars are actually the key to develop the entire ADHICS compliance framework. And now what is the benefit of ADHICS? So now I was talking about all ADHICS and all, but what exactly are you going to achieve with this ADHICS? Because I just spoke about the digital transformation, I spoke about cyber attacks, I spoke about it, but what exactly are the healthcare sectors going to achieve with this ADHICS compliance? So when you look into this, see the main reason, or the motive, if I say, on ADHICS compliance is a patient data security. So how are you going to secure the patient data? And so this way, for example, if you see the four important things that we have highlighted here, one is the early threat detection. Okay. So if there is any threat, okay, so you don't have to right, you don't have to wait for that attack to penetrate into your organization, and then right do a damage which you cannot recover from. So it actually helps you in early threat detection. And how exactly it happens, I think once we get into more slides below, where Anumi will walk you through. So she will actually talk about some different domains, and those domains will actually align how this early threat detection happens. Like you have data controls, you have access controls, you have a lot of different controls that comes with ADICS. So if you're actually adhering to all those controls, obviously your threat detection becomes like very, you will find out any threats in your healthcare sector very immediately. You don't have to wait for those threats to become and a worse thing for an organization. And then reduce downtime and losses. Okay, so obviously when you have the processes in place, when you have all the right things, like right, when there is an incident, what exactly I should do, when there is any disaster, what exactly am I supposed to do. So if you know those processes, policies, right, beforehand, so obviously in case of any emergencies, in case of any situations, so obviously you will, like, it will have reduced downtime, so you don't have to, like, maybe 24 hours or 48 hours of downtime, right? So you might just recover from that particular situation maybe in 2 hours, maybe in 1 hour, maybe in 4 hours. So obviously it is reducing the downtime and also the financial losses. And then insurance and trust improvement, when you're actually complying to ADHICS, so it is giving a trust to the patients and also to people who are actually getting, for example, like if you're an insurance organization. So if insurance organization is fully compliant with ADHICS, which means it is adhering to all the cybersecurity standards the DOH has set. So when you actually say to people that, okay, yes, we are ADHICS compliance, it actually builds confidence on people, and they are, because it actually gives them the transparency that how my data is being secured, how my data is being stored, right? Whatever my patient data, like for example, right, right, a person who is having some disease or something, so his data obviously he would like to keep it secured. He don't want his data to be revealed or right exposed to the entire world. So when I'm going to an insurance provider, the patients get that confidence and the transparency that yes, as they are ADHICS compliance, as they have all the cybersecurity standards met with this ADHICS compliance, they build that confidence and they have that trust, right? And then they go with this insurance, and also this actually improves or enhance the trust between the clients and the healthcare organizations. And then last, data protection, so which obviously I was just talking about, because it's all about data, how the patient data is getting stored, how the patient data is getting secured and all. So these are like the benefits or the advantage you get when you are getting compliant to ADHICS. Okay, and we next move to next slide. Okay, so maybe I'll ask Anumi to Anumi, can you just continue now? Thank you so much.
Yes, Mr. Shahnawaz, thank you. Good morning, everyone. My name is Anumi Verma, and I will provide the ethics insight in the coming slide. So, what ethics is and why it matters? So, ethics, as we all know, it stand for the Abu Dhabi Healthcare Information and Cybersecurity Standards, and it is established to cyber secure healthcare ecosystems in the Emirates of the Abu Dhabi that access, store, process, or use healthcare information. And this edX initially released in 2019 and later updated. Later on, this version is updated, and the current version is version 2, and that is published in the year 2021. And that introduces the new structure and the strategic enhancement. So, this is applicable to all healthcare entities in Abu Dhabi that are handling patient information, and it is developed by the Department of Health, DOH of Abu Dhabi regulatory body. And this is a critical framework, or we can say the mandatory framework, that for protecting patient treatment, personal data, and ensuring that the healthcare system resiliency in the UAE. And also the core purpose of the edicts is to protect the basic core principles of the information security, like the confidentiality, integrity, and availability of the health data. So by the mean of confidentiality, like if the entity is ensuring that they are maintaining the confidentiality, so that means the information is only accessible to those with the proper permission, or to those people who are authorized to have access to that particular information. And we can implement controls like encryption, access control, and data classification and protection as well. And next one is integrity. So so in we can entity can ensure that the data is not altered or modified with within an unauthorized way. Like we can implement control like hashing. And for the availability, entity can ensure that the authorized users have reliable or timely access to the system or the data or the medical records. So for that, we can implement controls like data backup, DDoS protection. This one is ADHICS domain. So total 11 domains are there, and every domain has a list of controls, and the control requirement specified by the ADHICS standard are grouped into basic 4 categories, like the basic, transitional, advanced, and service provider. So basic category contains the absolute minimum essential controls of information security, and the next is transitional category that contains the high priority controls to enhance the security posture of the entities. And this transitional category is applicable to the hospitals with a bed capacity of up to 20, and the centers like diagnostic center, dialysis center. And the next one is advanced, third one is advanced category, and this one is contains the essential controls, and these controls are applicable to the entity based on their entity status. And also, by implementing these controls, the entity can enhance their security posture of the health entities. And these advanced controls are applicable to the hospitals with the bed capacity more than 20, and health information exchanges like Malafi, Riayati, and insurers as well, and the third party administrator as well. So in ethics, total 11 domains are there, and I will briefly go over 5 domains in the coming slide. So information here, human resource security. So this domain is all about the entity needs to.
Anami, your screen
Yeah.
is struck, I believe.
No, I'm talking about this screen only.
Okay, sorry.
Okay. So this human resource security. So this domain is all about in entity needs to ensure that employee understand their security responsibilities before, during, and after the employment. Second one is asset management. So organizations needs to identify and protect information assets through maintaining asset inventory, proper classification and ownership and handling. Third one is physical and environmental security. So this one is the entity needs, by implementing this control, the entity prevents unauthorized physical access and protect facilities from the environmental threat. And next one is access control. So by implementing the control of this domain, the entity can restrict system access to authorized users only, or users only, or the processes or the devices that are that are used or that are needed for the business purpose. And next was it communication and operation management. So basically, the entity needs to implement the controls that are mentioned in this domain to secure daily IT operations and ensure safe handling of information across the network or across the infrastructure, entities infrastructure. And next one is data privacy and protection. So this domain is all talks about safeguard personal and sensitive data in compliance with the privacy law and policies. And next one is cloud security. So this domain talk about the applying strong controls to secure data, applications, and the workload in the cloud environment only. And next one is third party security. So in this domain, by implementing this control, the entity can manage and monitor risk that are associated with the vendors and the external third parties as well, or external service providers. And next one is information system acquisition, development, and maintenance. So the main purpose of this domain is to integrate security related controls or consider the security during the design phase. During the From the design phase, so means integrate security throughout the life cycle of the systems or the applications. Next one is information security incident management. So this talks about detect, report, and respond to security incidents effectively and in a timely manner. And the last one is information system continuity management. So by implementing this controls of this domain, the entity can ensure that the system can recover quickly and maintain operations during disruptions. Talking here, I will talk about the access control domain in detail. So the main purpose of this access control is to enforce security requirements such as confidentiality, integrity, and availability of information asset to prevent the unauthorized use of the resources or unauthorized disclosure of the information. So the main objective to ensure access to information systems are controlled and to minimize probability of information leakage or data loss, tampering, or system compromise. So here five essential access control practices that we can follow or that we can include in our policies in during our drafting our in access control policies for securing system and the data. So key requirements is role based access control. Like role based access control talks about or limits access based on the user's job function only, and it also helps to enforce the principles of least privilege, and it also ensures that users only have access to what they need, nothing more. And the next one is multi-factor authentication. So this one is all about add an extra layer of security. Like MFA enhances login security by requiring something like the passwords, and something you have, like a token on the mobile phone or some token devices, a- or something you are, like the fingerprint or the biometrics. So these three combinations or these two combinations creates helps to reduce unauthorized access. And third one is access review. So by conducting regular access review, entity can ensure that users only have access that they are currently needed to perform their job or perform their roles. So this helps to identify this access review also helps to identify and remove any outdated or inappropriate permissions or accesses. The next one is user account management. So a strong user account, the entity needs to establish or implement a strong account management that includes controlled onboarding, like proper approval should be there, updates to roles, like if there is any transfer, so updates to roles, and quick deactivation when users leave. It also helps to reduce insider threats and orphaned accounts as well. Last one is audit trails. So audit trails basically logs access events and record who accessed what and when. So this makes it possible to trace actions and hold users accountable in future, like if something happened wrong. And this is also key for compliance and the incident response as well. So all together, these five requirements, if we include in our access control policy, they create a strong foundation for secure, accountable access to the system and the data as well. So next one is data privacy and protection. So the basic goal or the main goal is to protect patient data from unauthorized access, tampering, or misuse, and to also comply with the legal framework. And the key requirements are patient consent management. Like every time entity needs to obtain explicit or clear or we can say informed consent before collecting, processing, or sharing personal health information, that is PHI, like the medical record number, medical report, or the lab reports, or we can say prescriptions. The next one is data subject right. So in this controls talks about patient must have full control over their data. Like if they want to view, so they should be able to view, correct, delete, or request the copy of their data at any time. And in this case, entity also needs to respond to them. Next one is data minimizations. So this controls talks about limit data collection to what truly needed for care and the operations. Like for only that particular purpose, we need to take that data, and also we need to only retain that data as long as it needed for that purpose only. We don't need to store it longer than required. Next one is data encryptions. So for this controls talks about use strong encryptions when the data is storing at like when the data is storing like the data at rest and during transmission as well, to prevent breaches and any unauthorized access as well. Last one is data anonymization. So if any entity is doing some research or some testing, so at that time when you are using data for the secondary purpose, so like analytics, so in that case we need to protect that data. So we need to anonymize that data to protect the identities of that individual, but we can preserve also in the same time. If we anonymize the data, we are preserving their values, but we are just anonymizing it. So that is also essential. So together these five practices, or together these five controls, we can say, help safeguard patient data and maintain trust and ensure that the compliance with the privacy standard as well. The next one is communication. The next one is communication and operation management. So this ensures that the secure and efficient management of communication and operational process to protect sensitive healthcare information and maintain service continuity. So in this secure communication infrastructure, so a secure communication infrastructure is the foundation. This means that the use a strong encryption or and design secure network diagram or hardened systems to ensure sensitive information is not exposed during the transmit. Or we can use encrypted channel like VPN or TLS for the communication, and also hardened network components like the hardened components like firewall, IDS, IPS. And the controlled information exchange, like information exchange must be governed by some clear policies, like define we can define some formal procedure for the data exchange, and we can sign some agreement with the third parties if we are sharing with them. And also because this ensures that the data integrity and confidentiality during the data transfer from one party to another. And third one is information delivery to authorized stakeholders. So this one, by implementing this, we can limit information sharing to the verified users, and like we can deliver information only to those persons that are authorized to receive it. And for that we can use tools like digital signatures, access logs, and delivery verification. And to ensure this now, we can maintain some delivery verification control, like that helps to confirm secure and compliant communication with the parties. And next one is minimization of unauthorized access. So this one is talk about like if we reduce the exposure point or enforce tight access control, you can significantly lower the risk of sensitive information being accessed by the unauthorized individual. Like we can enforce strict access control policy and monitor and audit communications regularly. So by combining all these practices, we can maintain a secure operations and communication management. And this complete communication and operation management is not just the technical requirement, it is also a core part of protecting the systems and protecting the systems, or we can say protecting the patient and complying with the regulations, because this helps to keep healthcare system resilient as well. The next one is information security incident management. So in this slide, I'll cover how entity can effectively detect, respond to, and recover from incident information security incident to minimize impact on the healthcare operations and protect patient data. Because we can say because in healthcare, delays or the breaches can risk human lives as well. So this incident management is just not a IT thing, it's a critical for the clinical purpose, or for the clinical care and the to maintain patient trust as well. So the key requirements are incident response plan. So the every organization must have some formal incident response plan, and that should clearly outline how to recognize, report, and resolve incident before they escalate. The next one is incident detection. So basically, fast detection is a key. So implement some continuous monitoring tools like the SIEM systems or endpoint detection solutions that alert team to suspicious activities immediately. The next one is roles and responsibilities. So assign specific roles to team member, like incident response team that include incident handler, analyst, communicators, and establish an escalation path to ensure timely and effective response. Next one is communication protocol. So during an incident, a clear and secure or updated communication is crucial thing. So always use predefined template and encrypted channel to notify internal team as well as external regulators if needed without any delay. And last one is investigation and analysis. So after containment, and we also need to perform a detailed root cause analysis of that particular incident and understand how the breach occurred, like because this will help to strengthen the system and prevent the recurrence as well. So a well prepared incident response program helps protect not just the data but patients and operational continuity as well. And this whole preparation saves time, money, and reputation in future as well if something happened. La- Last one is incident information system continuity and management. So this domain talks about entity needs to ensure continuous availability and resiliency of critical information system in healthcare and minimizing disruption to operations and safeguard patient patient data. So in healthcare system, outages are not just technical, they can also impact the patient life. So continuity planning ensures care continues and no matter what happens. So for this, we need to prepare, we have to make our policy in such a way that includes some basic things, like we need to have a business continuity plan that defines how operations will continue during an IT disruptions, and it should be comprehensive, covering critical systems and services as well. That includes an incident response, recovery, and communication protocol as well, like update and also updated communication IDs as well. And next one is disaster recovery plan. So a disaster recovery plan focuses especially on recovering IT infrastructure, and it should ensure data restoration and the system functionality within the acceptable time frame. And that includes detailed technical recovery steps, backups, and failure systems and recovery timelines as well. Next one is risk assessment and impact assessment. analysis. So we need to identify threats like the cyber attacks, power outage, and we also need to evaluate the impact on our operations and data accesses. So basically, by conducting the risk assessment and business impact analysis, that helps to prioritize resources and prepare them appropriately, and also prepare them appropriately by implementing controls. Re- Next one is regular testing and drills. So we need, as we all know, plans are only effective if tested and regular, uh, if tested enough and tested and updated, and regular drills or a regular test helps identify gaps and improve readiness as well. So in, and that also ensure everyone, by conducting these tests we can also ensure that everyone knows their roles in a real time incident. Roles and responsibilities. So in this, we need to define who does what, like assign a clear roles and responsibilities across the department of BCP and DR teams that include IT, clinical, administrative staff, so that communication and recovery efforts are smooth and coordinated. As we all know, like strong continuity planning ensures that even in the time of disruption, healthcare operations stay resilient and patient care remains uninterrupted. If we implement or test our BCPDR regularly. So next is roles of IT in achieving and sustaining compliance. So basically, in the complex landscape of the UAE healthcare regulations, achieving and maintaining ethics compliance can be a challenging one. So that's why we need to partner with some specialized IT consultant, or we have our IT team. They are aware about the ethics compliance as well, to reduce the risk and ensure operational efficiency and build a long-term readiness. So, so we can do this by selecting and implementing a software compliance. Like if we hire some consultant, so they can begin by evaluating your existing hospitals or existing systems, such as billing softwares or insurance platforms or any critical applications, and identify any gaps. And they can also recommend or deploy systems that supports or that helps to minimize the gaps, like the if there is no encryption, so they can support encryption, logging, MFA, and data residency. Because in the ethics, they is also mainly focuses on the data residency, and data should be store or stay in the UAE only. So this ensures your infrastructure is not only secure but also aligned with the local compliance. Next one is secure system integrations. So healthcare system needs to talk with each other, like HIE, Health Information Exchange Platform is there, like Malafi and Riati, that talks between the for the information transfer between the insurance and the pharmacy systems. And for this, if IT consultant or the IT team is aware, they need to ensure that these integration are secure with the edicts comply with the these integration are secure and the edicts compliant by setting up EDI and or the implementing some secure APIs. The next one is technical support and staff training. So even we can say, even the best system fails without the strong support, like the consultant can provide continuous monitoring, patching, and vulnerability scan, but that is only the half equation. Like if the entity's employee or the if the entity's staff is not aware, so in that case we need to also empower our staff with hands-on training or phishing simulations, and by delivering some awareness session to strengthen the human layer of your cybersecurity as well. The next one is compliance, documentation, and coordinations. So, documentation is a critical part of the ethics. An entity needs to create, maintain security policies, SOPs, uh, doing, updating, conducting, and updating risk assessment, and also maintaining incident response plan. And the entity needs to conduct internal audit to check the preparedness and to ensure that the compliance with the ethics during the official official audit as well. So in short, I can say, like, if we are partnering with some IT consultant, or if we have our strong IT team, so that can streamline our ethics journey uh, to help secure systems and train people, and to make strong our infrastructure, IT infrastructure, and to train processes, and also that can help to reduce the regulatory risk, because ensuring entity that is compliance with the ethics is not because ensuring entity is not only compliant, but we need to also make uh, resilient as well during any disruptions happen. So common gaps and how to address them. So in this slide, I'll take a look at some common security gaps that we experience during our ethics compliance assessment, and the practical steps that we can take to address them in line with to make a compliant with ethics requirement. So this is first area is governance and risk management. So we identify that the some entities have, or generally absence of the defined governance structure, like there is no clear roles and responsibilities and managing roles and responsibilities or policies for managing information security. So we can fix this by establishing a formal security governance framework that includes approving communication, enforcing security policies, organization wide, so that everyone is clear on their responsibilities. Next one is risk assessment and asset inventory. So many healthcare entities either do not conduct the regular risk assessment, or lack full inventory of IT asset or the sensitive data. So as a recommendations, or as a improvement, we can perform a risk assessment periodically, and we can align them with the ethics controls as well. So at the same time, we can maintain and routinely update a comprehensive IT asset inventory, and we can ensure that like all the critical IT systems and data are mm, inventorized or maintained in the asset. So next one is asset access control. So frequent weakness. uh, Next one is access control. So generally, we saw that the organization is has implemented there's some inadequate implementation of RBAC, back access control, or poor enforcement of the least privilege. Or so to close this gap, we should implement a strict role-based access control. We should enforce multi-factor authentication and conduct a regular access review to ensure users only have access to the data that need, nothing more. And next one is data classification and handling. So common gap is healthcare data is not consistently classified or handled per sensitivity level. So as a solution, we can implement some data classification framework that is aligned with the ethics, and more importantly, train staff on how to properly handle each type of the data based on its classification level. Next one is security awareness training. So generally, we saw that the entity has control in place, everything in place, but the employees unaware of their responsibilities for protecting health data. So we can recommend by conducting mandatory ethics aligned awareness program, like including phishing simulation, regular refresher, and policy training to build a culture of security awareness across the organizations. So by identifying and addressing these common gaps, we can by identifying and implementing the control against this gap, we can significantly reduce risk and improve compliance with UAE regulations, and most importantly, we can protect patient trust and safety as well. Implementation roadmap. So based on our experience, we have created one roadmap here. Uh, Step-by-step roadmap here. So first step is initiation and gap assessment. So we can start by appointing a dedicated ethics compliance team, and their uh, first task is to perform a gap assessment, or to identify areas of non-compliance and documenting them in a formal report. And this layer is a foundation of a targeted action plan as well. The next is policy and governance framework. So in this step, we focus on establishing and updating our information security policies to align with audits, and this include clearly defining roles and responsibilities so that every stakeholder understand their accountability when it comes to information security. Third one is technical and administrative controls. So this is the most important phase, like it involves implementing key technical controls such as firewalls, endpoint protection, and encryption. And this in this we can also enforce access controls and MFAs to reduce unauthorized access risk, and deploying system and network monitoring tools for continuous visibility. And we can ensure system configuration, or we can ensure secure configuration of the systems. And finally, we can conduct a regular vulnerability assessment to identify and fix security weakness proactively. And the next one is training and awareness. So by implementing or technical controls, this is not just enough, because we need to train our staff as well. So this will involve rolling out addicts specific awareness program that include social engineering, phishing simulation, and it also important to track participation and comprehension to ensure that the training is effective and retained. Next one is incident management and business continuity. So here we focus on operational resiliency. Like first we develop and test the incident response plan. We also need to establish business continuity and disaster recovery plan. And by conducting tests, we need to ensure that the critical services can continue during the disruption as well. For that, we can to ensure that we can conduct some tabletop exercise to test our readiness under the simulated incident scenarios. And the last one is internal audit and compliance review. So the final step is to perform internal audit that is aligned with the ethics version 2 standard, and we need to document any non-conformity. And going forward, we need to implement corrective actions, and we need to prepare for the external certification or the regulatory review if needed, because this whole will ensures that we can maintain by doing this internal audit or internal assessment or ethics compliance review. We can ensure that we can maintain a compliance over the long term. So this complete roadmap is not just about the ticking boxes. It's all this can also helps to create a secure, resilient healthcare environment that can protect patient data and meets UAE regulatory expectations as well. So that's all. This now we can move to next session, questions and discussions.
Yeah. So like we're happy to take any questions in case, right, you have any questions you can, right, post in the chat,
Y-
or you
y-
want to ask, maybe you can ask.
Anumi, you can just share the next slide also for taking that feedback.
Sure, sure.
Yeah, Mr. Ahmed, you can ask the question.
Hi, thank you for your fruitful session. I have actually two questions regarding the data protection and confidentiality. So ADICS in version 2, they are talking about DPO and DPA, data protection officer and data protection analysis, right?
Right.
So we have to hire a person as a DPO, and if yes, this person should be under IT or should be outside IT, like compliance or internal audit.
Actually, this person DPO acts independently. This is not under any IT or the compliance team, audit
Ah,
team. This person
so
should be work independently, DPO.
so we should an organization update our organization chart and create the department of data protection, right?
Yes.
Ah.
Yes, we have a question from Mr. Rahil. This is says that this is for the IT. Yeah,
But
please.
and I have
Please.
a second question regarding the BCP, business
Mhm.
continuity plan. You are talking about business continuity from IT or from whole the big picture, because business continuity it is not IT only, it is the management, key
Mhm.
person. So here in business regarding ADICS, it is IT or business continuity from business side.
It's mainly focused on the IT because it's only talk about the continuity of the critical system services that is
Okay,
related to the IT.
okay. But who will determine the recovery point or recovery time?
IT
Is
team.
the IT team? But
Yeah. After the discussion with the, of course, after the approval from the business team, but this things recovery point and everything, this is related to the IT softwares as well, like IT systems, IT infrastructure. That's the main thing. Like we need to have a discussion with the IT and the business team as well. Business approval is required.
yeah, as
Yep.
I believe this just should be as a risk, to identify it, how much data loss data, 1 hour, 2 hours, is not a pure IT. This is IT and management. You can,
Yes, that's the reason I'm saying that there should be discussion between the IT team and the management, because at the end the decision taker would be the management, and based on that the IT team will implement. The
okay,
management needs to decide at what time or what the RPO should be for this particular data.
okay, okay. Thank you. Appreciate. Thank you.
Thank you.
Yes, thank you. Anumi, Mr. Rahil has a doubt. He says that this is for the IT staff implementation, but what about EMR like Unicare, Doc32, etc., third-party providers, and Malafi, which is handled by Etisalat?
Mhm.
So he has a question. He has a doubt. What about EMR like Unicare, Doc32, and
Yes,
Malafi?
yeah, so they also need to implement this. I didn't get correctly. Like, what's the
Yeah,
question?
yeah. Rahil, can you just ask the question here, Mr. Rahil? You can look into the chat, Ms. Anumi. Any other questions? Any other questions? Yeah, what he says that the softwares are handled not just by IT, but about other one which is handled by other team like EMR.
But if this contains like the this third party contains the data, patient data, or the data related like PII or PHI, so that also should cover within the scope of the ethics compliance.
Okay, so maybe Rahil, see, the point is, irrespective of what exactly is it a third party, whether it is an in-house applications or irrespective of it, if the organization that is operating under the this right under the DOH, right, the Department of Health of Abu Dhabi, uh, and if they're handling any sort of medical data, be it the patient data or the medical equipments or asset inventories, or maybe for that matter, maybe they are sharing some medical equipments to the healthcare organization. So anything with respect to handling of medical related data or healthcare related data needs to comply to this ADHICS compliance.
And also, if they are these third parties are only providing the software, so there is one control category is there, service provider. So basic these control categories, these controls should be implemented in them, in like should be covered in this software. Like one separate control category is there for the service provider in the ADICS.
Okay, any other questions? Rahil, is that clear for you? Yes. Any more questions? Please scan this QR code and give us the feedback. I will share the Google review in the WhatsApp, but this one is taken for our internal purpose. Please share your feedback after scanning this. Any doubts, or else we can wind up the session? Shahnawaz, anything else to add?
No, Manish, I think we are good.
Okay, fine.
So we just want to let everyone know that right, we are here to help. Anyone have any queries, any concerns, or anything with respect to ADHICS compliance? I think we are here to help. And you know the contacts, and you can always connect us. Thanks so much.
So hope you have given the correct name when you have logged in, plus the email also already been registered with us. We'll be sending the digital certificate, participation certificate, and the presentation with you in another few days. Okay, so thank you for participating. Thank you for attending this session in your valuable time. Thank you very much.